Dr. Waheed Zaman with us today. And when we're talking about him, we are going to talk about a very prevalent, very important topic, which is kidney stone management. And the very first question which comes to my mind when I see you is, why do you think the number of cases of kidney stone is rising constantly day by day these days? What could be the reason?
Reason is definitely geographical.
Yeah.
Because we are in tropical country,
Mm-hmm.
hot weather,
Yeah.
and we are not drinking properly drinking water and other things stuff. We are dehydrated most of the time.
Yeah, right.
So that gives the concentrated urine and chances of crystallization and stone formation is there. Another is dietary habit. That is also there.
Right. Well, what has been the most challenging case of kidney stone that you have ever dealt with, and how did you remove the patient's stone? Any instance?
No, we came in my career of around more than 27 years experience. I have seen many complicated cases, complete stag-on involving whole of the kidney,
Oh.
giving the kidney shape almost whole of the kidney. We have done in late 90s, and this we used to do anatropic nephrolithotomy, that was open surgery. But gradually with our experience and this, we have started doing PCNL in a stage way, like PCNL in 1 or 2 stages. So we can remove most of the stone. Nowadays I don't remember in last 20 years I have done any open surgery for stone disease, kidney stone. We are all managing with endoscopically, that is the PCNL, that is percutaneous nephrolithotomy, and with if multiple stones are there and bulk is too much, then in a stage way, in 2 stages. In most of the cases, we are managing in a single stage.
That's amazing.
Yes.
Well, when we are talking about the same thing, I would like you to tell me that what do you think is going to be the next breakthrough when it comes to kidney stone domain? What could be the next big breakthrough actually?
Well, nowadays, people are more aware of stone disease and
Yeah.
this. So, what we are getting now in last 10 years, if you see, smaller size stones are more common. People are coming earlier, I think, because of better diagnostic facility available, awareness of the people. Probably they are less neglected. So we are getting smaller size kidney stones nowadays. So getting gradually now RIRS is more popular, that is retrograde intrarenal surgery. So we are managing without incision. Means this time through the urinary passage, through the urethra, bladder, and entering into the ureter. With the flexible ureteroscope, we are reaching up to the stone in kidney, and we are with the advent of laser availability of latest laser, right from holmium and thulium fiber lasers, and we can reach to any part of the kidney with that flexible ureteroscope, and we are managing now most of the cases without any incision. So now people are coming, like we are practicing in Delhi, I am in Max Hospital, people are coming and they are asking for surgery without incision. Means they don't want even small incision, like PCNL we put incision, 1 or 2 stitches there. So they don't want that. So everything they want through without incision. So this is one of the latest addition. I think it has really, it is popular in India now. That is RIRS, that is retrograde intrarenal surgery. More miniaturization is there. We can do PCNL, mini PCNL, ultra PCNL. With a very small incision, even stitch is not required, because now energy sources are very good. What we are getting, like laser machines are available in most of the places, so we can do this and we can fragment, we can dust this stone. So even miniaturization of instruments as well as the advent of new instruments, and fragmentation technique has changed with the advent of laser energy. So definitely those days are gone most of the, but still what I feel in the remote areas, in rural, still we are going with the open surgery. But in metros and big cities, definitely endourology is far ahead. And I think I can say proudly we are world leaders, I think, in endourology. managing stone disease.
Well, when we are talking about the same, if a patient is delaying the visit to the health specialist, what could be the consequences if he or she is delaying it a lot and now it's getting severe and then they are coming to you? What are your go-to management solutions?
This is very important question. We are facing almost in day-to-day practice. What people are neglecting when stone are there, they are going for other therapies.
Yeah.
Those who are not following properly, like in our field, we are following our patient with imaging techniques and this, where stone has gone, whether it is growing or not. So they are going for alternative medicine without proper follow-up and imaging. So what is happening, many of the cases are neglected one. Few lucky ones are passing stones spontaneously and they are getting the credit that see that we have taken this medicine and it has come out. But if you see less than 4 mm stone, almost 90% stone is going to come out of its own if you drink properly. No, if you drink plenty of water and this, so it is going to come out in almost 90% of cases. But as size increases, chances of spontaneous passage is very difficult. It goes down gradually, that percentage by, if you see, if it is around 1 centimeter, chances is hardly less than 10% stone will come out spontaneously. So what is happening now, people are still they want to avoid surgery or this, in spite of this modernization in our endourology techniques and this. They are going for alternative medicines, not following it properly. Small stones are destroying this kidney because of obstruction. This is obstructive uropathy, and we come across many cases with CKD, impaired renal function, that is chronic kidney disease with bilateral obstructive uropathy. Both side kidneys are gone with this stone. They are not following it properly, or for years together they have neglected, they are taking alternative medicines. So I want to say here that I am not objecting on this, but definitely proper follow-up should be there.
Yeah.
You should be in regular touch with the doctor, how it is, whether it is growing or not. People are not doing kidney function test on this, and what is happening, they are coming with high creatinine. And bilateral obstructive uropathy, landing for hemodialysis straight away. With 15, 16, yesterday night only I have seen one patient with bilateral pyonephrosis. Neglected stone with creatinine of around 15 and TLC around 30,000. So this is due to negligence.
Yeah, true.
So if you don't manage properly, this kind of things happen. And if you see in India, in CKD list, cause of CKD, stone disease are almost 4th or 5th major cause.
Right, right. When we are talking about the patients, for example, there is a patient who had a stone and now it's gone. So what he or she could do to prevent the recurrent stone?
Yeah.
Yeah.
It's very important. We should not forget after the
Yes.
treatment.
Yes.
And many times people think that once we have operated, now it will never reappear.
Yeah.
If you see the statistics, almost 50% patient can have recurrence within 5 years. 50% of stone
50%.
and if you don't treat them properly, and that most important is prevention. Prevention is better than cure. We have to modify our lifestyle. So first of all, we tell the patient to go for stone analysis, and then we do metabolic workup properly. And based on this, in metabolic workup also one important thing, we can get the proper cause only in 20% of cases. 80% it may be normal also. Still we have to take precautions with dietary and precautions we have to take. We have to drink plenty of water. I think hallmark is water, plenty of liquids.
Is needed
And proper follow-up is needed. Don't forget, and don't think that once stone is there, it will never reappear. It is going to reappear.
in 50%.
If you don't modify your lifestyle, if you don't take liquids, fluid properly, then it is going to reappear also.
Right. Thank you so much, sir, for your valuable answers. I hope that we were...
Great pleasure.
Yeah, actually. Thank you so much for being here.